get to understand how important it is. And before then, let's pray. Heavenly Father, we thank you for this day. We thank you for bringing us together as a family. As we are about to share knowledge, we pray that you, Lord God, will guide us. Give us the spirit of understanding so that we might benefit from what we are about to share. We thank you and we hope that you give us a great understanding and bless us through this program. So, today we are going to talk about oral health and oral hygiene as well. They kind of look almost the same, but there are some slight differences. So we have to understand the differences and how each of these affects our general health. So we will look at a brief introduction, that is the definition of oral health and oral hygiene. The oral hygiene part, oral hygiene practices, importance of good oral hygiene, signs of poor oral hygiene, and in a good conclusion. This is going to be more of a conversation rather than giving a talk or a speech, because it's more practical, and I want each one of us to understand it. Hygienists wherever we are. So let us start with the definition of oral health. Oral health is a state of the mouth, teeth, and orofacial structures that enables individuals to perform essential functions such as eating, breathing, speaking, and encompasses psychosocial dimensions such as self-confidence, well-being, and the ability to socialize and work without pain, discomfort, and embarrassment. So we can see that oral health constitutes a lot of things rather than what we know. Because we are talking about self-confidence here, we are talking about discomfort, we are talking about psychosocial part of oral health and embarrassment. Oftentimes we are embarrassed by our mouth, and most of this is as a result of poor oral hygiene. This is supposed to be taught right from the beginning, which I believe that in some countries right from the beginning, from primary stage, we go around to teach children oral health so that they would understand it. So right from the beginning, they build these oral hygiene practices and are able to have good oral hygiene throughout. Unfortunately, over here, little time is given to that. So I'm currently working on a project to be able to give out oral health education to children, possibly in schools and in other places, so that people can also benefit from such activities. Oral health. Now let's go to oral hygiene. Oral hygiene, they are daily practice of careful, the word daily, practice of careful, frequent toothbrushing or tooth and gum brushing, combined with flossing or methods of cleaning between teeth to remove particles and plaque. So we are saying that oral hygiene is a daily practice. Daily, the word daily. Some people happen to remember their oral hygiene practices on days that feels relevant to them. However, it's not such. It's supposed to be daily, because as you'll get to understand that when we leave our mouth without giving it the oral hygiene practice, there's a buildup of plaque. Plaque, normally, probably you might not see, but they are on the teeth. There are these white, soft film coatings that you normally see on your teeth. Sometimes, if you happen to use any material, any maybe anything that you can send your mouth and just scrub, you can see some yellow, some whitish film coat on the street surface. It's called plaque. And these plaques, they are very dangerous. They have to be taken care of by brushing frequently. Because as you continue to brush, you remove them. They are formed as a result of the bacteria that are in our mouth. They are oral flora. They are in our mouth. They are supposed to be there because they contribute to even the cleansing of the mouth. However, I don't know whether people who we know that there are more bacteria in the mouth than any other part of the body. There are a lot of bacteria. So these bacteria, if we leave the food that we eat in the mouth, they work on them, producing plaque. This plaque would then harden up, sometimes to form what we call capsules. These are the yellowish hard substance that we find on the teeth. So sometimes when you look into the mirror, you see these yellow parts that are on the teeth. They are called capsules. It's for a longer period, leaving the plaque, dental plaque in the mouth, it hardens up and forms plaque. And this plaque, sometimes you see that your gum starts to go down. You see that your gum is not at the same level because that plaque has the ability to receive your gums. So the gum starts to receive and weakens up the teeth. There is something we call periodontal disease or gum disease. We have the simple one, that's the gingivitis. That is, the gingivitis is a simple inflammation of the gum. So when the gum starts to inflame, you start to see sometimes it becomes reddish, a little reddish. Then it starts to pain because there's an inflammation process. Gingivitis, it is normally in medical terms is inflammation. So if there's inflammation, this inflammation later on we will get to understand why it is very, very important that we prevent this inflammation because they can be a source of a very dangerous health condition that we'll get to know from our presentation. Then now let us look at the oral hygiene part. Please, can anyone mention any of the parts that we expect to have in our oral hygiene? Please, as I said, it's supposed to be more of a communication or a conversation rather than a presentation. When we say oral hygiene part, what do we expect to have? Can anyone just mention anything? Anything that you can expect to find in oral hygiene part? When we say your oral hygiene, what do you use for your oral hygiene? Toothbrush, toothbrush and toothpaste. Anything else? Chewing stick, Okay.
Chewing sponge.
Chewing sponge. You see, so we are limited in this knowledge because we only see oral hygiene part as toothbrush and toothpaste. But if you look there, we see more than toothbrush and toothpaste. We see the first one, that's the two white ones that are on the other side. It's called the dental floss. You can have them in a form of thread, but mostly this is now common because of its easy use. The thread is more technical, so some people find it very difficult to use. So in order to make it easy for us to use the dental floss, we came up with this, which would be very easy to use. You just put them in between your teeth and you bring them out so that we wouldn't be able to brush in between your teeth because the brush cannot go there. The space is so tiny that it's not possible for your toothbrush to go there. So we have the floss to be able to move in between your teeth to remove all the food particles that would be stuck over there. Then the next one that we see is the tongue cleaner or the tongue scraper. One part of the mouth that we neglect or we forget to work on is the tongue. It's very, very important we brush and clean the tongue as well because most of our bad breath comes from there. So when you eat continually and you are brushing the teeth, forgetting the tongue, there's accumulation of these food particles that you left there and they can cause bad breath as well. So after you brush, don't forget to use the tongue scraper or the tongue cleaner to clean as well. There we have our toothpaste. The toothpaste, we don't give brands of toothpaste. What we require is that your toothpaste should have fluoride. have severe consequences because of the toothbrush they use. Not only how they brush, but the toothbrush they use. Then we have the last one, that's the mouthwash, as the main component of our oral hygiene bag. We mentioned the chewing stick and the chewing sponge. We are not excluding them, even though generally you can't find them here, but those are our own practices that we use to brush our teeth. We recommend that besides chewing stick, we add the toothpaste to it to help us to strengthen our teeth. Then the toothbrush. Now brushing, as I said, is supposed to be gentle and at least twice a day. Rather unfortunately, most of us forget the second part, that is the evening part before we go to bed. Imagine you eating all kinds of food throughout the day, then going to bed without cleaning it. Sadly now, we tend to brush our teeth in the morning. Most of us do it not because we want to keep our teeth clean, but we want to just prevent our mouth from smelling. Because you yourself, you know when you wake up in the morning without brushing your teeth, or even when you brush in the evening, you will realize that in the morning you still have the mouth smells. And does anybody know the reason why the mouth smells? Because when we wake up in the morning, because we keep our mouth closed most of the night, most of the time. Our mouth, when you're sleeping, your mouth is closed. Some people can have the mouth open during the night, but generally the mouth is closed. So it's serving as a playground for the bacteria that are in the mouth. The end product of the bacteria, then now will be the plaque and others that will cause your mouth to smell because you have closed your mouth all this time and they thrive well in a closed environment. So that is why even sometimes when you realize that you have kept your mouth in the day, you see somewhere you close your mouth for long and you wake up and you feel that there is a small smell in your mouth because you have kept it closed. So the toothpaste, as I said, should be fluoride based. And the toothbrush is supposed to be a soft to medium bristle brush. Soft to medium means that when you touch the bristle, that's the part that we use to brush our teeth, it's soft. Medium somehow. But this hard bristle doesn't clean our teeth. You are causing more harm than good to your teeth because at the end of the day, what you're doing is that you are scraping the tooth off. And please be reminded that tooth brushing is not synonymous to scrubbing. Some people, when they are brushing, it's like there's a simple wall or they are scrubbing the floor. Oh no, please, you are mad. What you're doing is just harming your teeth because there is something we call teeth wear. Teeth wear can be in different forms. We have abrasion, which is the wearing away of, when you look at your teeth, between the gum and the teeth, you can see that sometimes there are some wear on that side, especially those of age, because you have been brushing for a long time in the morning, from childhood to that age. So it means that by scrubbing that place for long, you end up removing those tooth particles. Normally, that part between the teeth and the gum is soft, so they wear off easily. So as you continue to brush harder, these areas wear off, and they kind of cause another tooth issue that we call let me say tooth wear. That's the general name that we call it, but you can have sensitivity, a lot of sensitivity, because the dentine, which is the sensitive part of your teeth, is there. So as you brush that much and remove all this, they tend to pain a lot, and you come for us to do fillings. So we will advise that most of your toothbrush that you use should be a soft to medium bristle brush, not the hard one, the smokers that you use. The harder the toothbrush doesn't mean that you're doing the right job. It means you are causing more harm than good. And it's supposed to be gentle. Later on, we look at how to brush. It's supposed to be gentle as not as hard as we do it. And when you are brushing, try as much as possible to brush forward the teeth surfaces. Some only take the toothbrush and outside. They are done. You forgot there is the inner part. You forgot there is the occlusal surface that's on top of the teeth. And you forgot there is in between the teeth. So all these parts are important. And as I said, you always have to remember to brush the tongue as well. Flossing, we have talked about it a little. That's using the floss to remove the particles in between your teeth. That is the first part, the first one, which is easy to use. So you use it to, you pass it in between the teeth to remove all the food. It's not difficult, just up and down movements. Then you will remove all. And this is the other one, which is the form of thread. It's quite technical because you have to hold it in certain angles and remove them. But if you can use them, it's so advisable. This is another form of floss. Then the interventional brushing. Then another part of oral hygiene is the healthy diet. So when we talk of healthy diet, we are talking about limited food that doesn't have a lot of sugar. In dentistry, there is what we call pyogenic foods. These ones are food that have a lot of sugar in them. They are the prime suspect when we are looking at dental caries because they cause caries to our teeth. So sugary foods and drinks tend to contribute to dental caries formation. So they decay the tooth. It doesn't mean we can't, but we have to try as much as possible to limit them and brush your teeth when you take this. It's not really good to brush, to eat sugary food and go to bed. That means that you are breathing the microorganisms that are in the mouth, they get the food that they need to be able to create this they create this plaque, dental plaque that would cause dental caries and periodontal disease. Then, as much as possible, we try to visit our dentist or do a dental visit. And let's know that dental visit is not only when you have a dental disease or a problem. Dentist is your friend. Children are to be encouraged to visit the dentist. Sometimes you just take your children or yourself, you go to the dentist, and look at your teeth. We look when they are in, we congratulate you, we give the children a form of encouragement so that they will continue to do that. The environment might seem scary, but I don't think it's too much. Just when you see the instruments, they are sharp, but at the end of the day, we don't use them to cope. We just use them on the teeth, which respond to our treatment. So at the end of the day, we are encouraging that at least once you visit the dentist a year, once, then you go. It can be a source of detection of something that could potentially cause a lot of harm because just simple visits, we can diagnose some common conditions such as oral cancer. Just a common visit, you can look at your mouth, and you know some diseases generally are first diagnosed in the mouth. Patients with even HIV/AIDS, you have oral manifestations that can give you a hint that this patient could have such disease. So we do further examination. Then we recommend that you then see a general medic if need be. So sometimes it is needed that you come, not only for us to do something for you, but we just want to see you. Maybe we also need some friends, so you come and we look at you. And sometimes dental caries, later on, this is the first presentation, but later on we have some subsequent ones where we will see that dental caries, just what we call catarrh, can end up causing you to visit your early grave. We've had a lot of patients who come as a result of dental caries. You look at them and you tell, okay, at this point you have okay, let us give you some education, go and come back. And you do some extraction or some filling for you, they'll go and never come back. And next time you see them, they are in emergency, waiting for something we call incision and drainage, because you have oral swelling. The jaw will swell a lot. Then you have something we call herpes angina, which is a swelling of the whole jaw. It kind of makes you feel you are choked. It blocks your throat. It is going to block your trachea, and in that way you are not able to breathe. And it can cause your death. So just a simple toothbrushing that you didn't do would lead to a process that can cause you to early grave. So it's so sad when you see somebody dying as a result of toothache. So please, let's not think that visiting the dentist is for some complex procedures. Sometimes you come and you need to do cleaning to remove all this. As you do cleaning, you can detect all these conditions and take good care of them. Now let us look at the importance of keeping good oral hygiene. Oral hygiene is a preventive care. So what we do is that we brush our teeth, so we are preventing our teeth from having dental caries. We are preventing our gums from having gingivitis, and some people also call periodontitis, which is the advanced stage of the gingivitis. As I explained, that gingivitis is just swelling of the gum. So when there is inflammation of the gum, it can later on go deep and form what we call periodontitis. That's the inner part of the teeth, the down part. So when it leads to that, you can have your teeth shaking. So when your teeth, somebody can come and your whole teeth, or most of them are shaking. It's as a result of periodontitis. It started with just gingivitis or some small inflammation, leading to periodontitis, the weakening of the teeth. So let's keep good oral hygiene to prevent these cavities and gum disease. Also, it's an avenue for us to detect other health conditions such as mentioned HIV, diabetes, osteoporosis, oral cancer, and treat them early accordingly, because we know all these are very dangerous diseases that need urgent care right from the beginning. So let us visit the dentist, or generally keeping good oral hygiene prevent us from getting these diseases that can lead us to our early grave. Then to help prevent heart disease and stroke. Some of us, it would be shocking for us to know that just gingivitis can lead you to have a stroke or heart disease. It's difficult to believe, but yes, it does. There are some evidences and a lot of papers that have been published. Because when there is inflammation of the gum, as I mentioned, there are some bacteria that are involved. This inflammation have this bacteria that can move through the bloodstream to other parts of the body, the brain, then cause inflammation around this place and blood clots that will prevent blood from reaching the brain and other parts of the body, causing stroke. So just a simple oral hygiene, toothbrushing that you didn't do can lead you to have stroke. There are papers that have been published. It's not just ESC, it is real. So let us, as much as possible, keep a good oral hygiene to prevent this from happening. Then good oral health and self-confidence. Of course, if there is good oral health, you feel confident, you're able to smile, you are happy at work, because when you have just a simple toothache, it can spoil your whole day. If you've never had toothache, you wouldn't understand what is pain. Maybe women who have gone through birth understand real pain, but toothache sometimes will make you want to hit your head against a wall, because it's very, very painful. You can see people, I personally, truth be told, haven't felt it, but how I see people who are in pain every day as well, it's not something pleasant. So it means just keeping a good oral hygiene can prevent all this. So let's, as much as possible, try to keep good oral hygiene. Then, what are the signs of poor oral hygiene. Number one, bleeding gums. So when you brush your teeth and you see blood, first is as a result of oral hygiene. Except for that the bleeding, you have oral, you will have bleeding because the gum becomes weak. And when you brush, it becomes soft and it bleeds easily. It doesn't mean that when you see bleeding, you have to stop brushing because it's painful. It means you have to do it more because as you bleed, you continue to brush your teeth. You bleed, but subsequently the bleeding stops. You also have to combine with warm water. Warm water with salt solution and it helps a lot. But you have to come for us to do cleaning, remove all these calculus and plaques that have been formed to be able to help your teeth and the gums recover easily. Then if you have tooth decay or aka catarrh or cavities, it means that you have not kept a good oral hygiene and that you have to revisit your oral hygiene to be able to get or to prevent this tooth decay. And obviously you have to visit us. Sadly, in this modern age, people still believe that toothache is spiritual. So you have a lot of people. Excuse me. Sometimes pastor says that you have to do certain things that are professional fighting for his life. And unfortunately, he couldn't make it because when he went back, he went to the prayer centers praying for the toothache. I had plaques that are formed on the top of the teeth or normally at the gum surface area. And the swelling, as I said, swelling is a sign of oral hygiene. So if you have any of these, then you should know that your oral hygiene is not up to standard and you then have to work on your oral hygiene because they can lead you to certain complications. So this first part was just for us to get to know the general concept of oral hygiene, what it entails. I will also give some practical demonstration of how we have to brush our teeth because somebody will say, but look, I've been brushing my teeth every day, but I still get caca. It's because you don't do it well. As I said, it has to be done and be done well. So let us really know how to brush to prevent any complications. In conclusion, oral health constitutes a vital part of general overall health. Therefore, it is paramount to keep a good oral hygiene. As I said, if you have toothache, you can't be able to go to work. Your whole body, you then feel it. It's not only the teeth that suffers, your whole body suffers. So we also know that almost everything or 99% of what goes into our body goes through the mouth. So it means that it is somewhere we have to keep a very good hygiene. Then keeping good oral hygiene can prevent diseases like cavities that I've mentioned, gum diseases, bad breath, among others. And oral hygiene practices like brushing, flossing, healthy diets, regular visits to the dentist or dental visits are essential for good oral health. Regular visits to the dentist can help reduce the need for future complex procedures. As I said, sometimes you just need common cleaning, common filling, some small filling, that's so painful. But you wait until it becomes so difficult that at that moment you come and you have to lose your teeth because of that. So at some time you need to do something called root canal, that is saving the tooth. And you have situations where, as I said, can cause us to do incision and drainage. That is when you have jaws swelling. So just a simple visit to the dentist that you have taken about 30 minutes, and now you spend 1 month, 2 months at the ward fighting for your life. So let us try as much as possible to visit the dentist or keep oral hygiene to prevent all these things from happening. Then it can boost your confidence by giving you a beautiful smile. Yes, when you can smile beautifully, when you know that you can open your mouth, there's no bad breath. And obviously, you can have that confidence to smile. Some people, in my line of work as a odontist, I'm glad that sometimes there are procedures to give. Some patients might come with very low self-esteem. They can't smile, they can't open their mouth. They are pulling their teeth because of how their teeth look. So you are able to change their smile through orthodontics is just about more about braces, even though it encompasses more braces and other treatments that are used to straighten the teeth and give people the confidence. Sometimes it's not just about aesthetically straightening them, but some people can have jaw problems because of how their teeth look. So it might be that your teeth are crowded, but it can cause you to have jaw problems. And it can also prevent you from brushing, or that can lead you to gingivitis. And I said gingivitis can be a source of cardiovascular disease and stroke. So there are things that are related. So let us try as much as possible to keep good oral hygiene and prevent all this. We are reminded that a healthy mouse lives in a healthy body. So let us, as much as possible, try to keep a healthy man so that we will have a good or better health in general. Thank you very much. That's the little I have to do. I'm going to do a small demonstration on how we have to brighten up that we will ask questions, more questions are welcome. So let's assume this is our mouth. So we have different surfaces. This is the outer or the buccal surface. The part that you use to chew is the occlusal surface. Inside that is the front, the one you use to bite. Then you have the lingual, where the tongue and the palate, the inner one is the lingual surface. So when we are brushing the interdental surface, the middle and distal, you're supposed to brush all these parts. So brushing doesn't have to be 30 seconds. It has to be structured in a way that you would be careful to brush all the surface. So let us take this. We are then now going to divide our teeth into 4 parts. We have, and it's equal, 4 equal parts, except if you have some teeth out. Generally, as an adult, grown adult, you are expected to have 8 in one quadrant. We call it a quadrant. 8 in another. That will give you 16 down. Then you have 32. Maybe you have taken some out, or some might stay in the bone and not come out at all. Or some people have less by their bone. So generally, you divide it into 4. We take one part, that's a quadrant. Then we start. Slow and steadily, you brush in circular motion. This way, this way. So we are saying circular because look, we then now take food particles from that in between the gums or where it is out, so out. If you do this, what are you doing? Most of people do that. So when you're doing this, and mostly those people don't floss, you're doing this means you're pushing the food to in between. So you're doing this. The brush is not able to go there. Well, so you're pushing it in between. So at the end, most of the people have cavities interproximal. That's there because they're pushing the food particles in between, and after that. So when you do this, you're removing what is between. So when you do that, you're taking it out, and you remove, as I said, soft or medium. So the soft one is able to go in between. So you take one quadrant, then you move, you go and come, go to all these parts, and you come again, you move it that way. You're supposed to spend time brushing. Then after that, you go to the other part. The same thing. Round, 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 round. So you have done the outer surface. And the inner surface, you take the brush, you're still supposed to do that round movement here. But when you get the front part, it's out of it. But when it's very difficult to do round in front here, when you do out of, you have to be able to pull everything that is over there out. Likewise this side. So you have done outside, inside. Then now you come to the occlusal surface, as I said, that you can do it this side, the horizontal one, because you are removing everything out. And after that one, you go to the down part and do the same thing. So we come to the down, likewise, circular motion, all these parts. And brushing has involved the gum as well. It means that it's not a strong stroke to the gum, a gentle stroke to the gum. It's like massaging the gums as well. You move them, you move them, you move them, the brush all to the outer surface. Then you go to the inner surface as well. You do the same thing as I said in the front. You bring them out towards like that. If you are standing in front of the mirror, which we suggest that brushing should be in front of the mirror, then you are able to see all these parts and then brush it accordingly. This part as well, you do that, you do that. And the last part that we should not forget, as I said, is the tongue. You can use your toothbrush to brush it, and also the tongue scraper or the tongue cleaner. You can use it to remove all the debris. It's like that. So you remove it and remove all the debris on the surface of the tongue. At least once a day is fine. So that's the general way of brushing our teeth. You can do it, but you have to do it well to benefit from the importance of brushing. That would be it. Questions? I will. Listen.
You mentioned that one is salt, water, or a part of the arm. Can one dissolve water and brush without for the water salt for the salt? Can one use it? If yes, how often? More than evening or as long as one year. And then also, I want to visit the dentist. Okay. As often as possible. Does that go at the cost or without the cost? We want to do that to bring something or there is a medical program before we do something. And then another question. As it is taken, what's supposed to happen? But sometimes the teeth come, this is more once you come, that's the one that's permanent. But some of okay, if that's some no teeth comes out.
All right, thank you very much. The first question about using salt solution, it's not a daily practice of using salt solution. As I said, it's mostly required when you have gum disease, when your gums are now inflamed. So we will need as salts to help in reversing the inflammation. So generally, the salt solution is supposed to help heal the wound or the inflammation that you have, but not a daily practice. And salt solution, as we know, does not contain fluoride, as I said, which is an essential part of the toothpaste. So it means that we recommend you use that when you have bleeding gums alone. Please, is that answered? Okay. Now, the other question that has to do with the visiting of the dentist. Yes, here we recommend you visit the dentist. Fortunately for Cape Coast, which yesterday I was talking to my colleagues, they were shocked is that Cape Coast happen to be one or if not the only health facility that accepts a lot of health insurance. So you can come to the dentist and most of the procedures are, especially people care, covered by insurance. When you come, you have a toothache, it's covered by insurance. You have to do some filling, covered by insurance. Cleaning, it's not covered by insurance, but it's not expensive. But I'm also coordinating that ICGC, we can have sessions where we have very affordable prices for our members. I will coordinate that and get you informed. Then you come, we do cleaning for you at a very reduced price so that you can. But generally, it is not, cleaning is 200 and above, but we are working to subsidize the price for our members so that you can be able to clean your teeth and have good oral hygiene. So that is that part of the. Then I think there was another question. Comes off. Okay, yes. The part on the tooth coming off, as I said, generally, tooth or teeth come off as a result of gum disease. That's periodontitis because your gum is now weak because of the plaque and the calculus that have been built. So they receive the gum, they break the bones that are in between your teeth. So it kind of move it upwards. So as before the teeth comes off, you see that it is loose. When it's loose, it's because periodontitis has affected it. So it's old age or mostly though we can have people. I have had a patient about 25-year-old that came with aggressive periodontitis that all the teeth were shaking about to come off. All the teeth shaking about to come off. It took us a lot of work to be able to get them strong. But imagine this person might have stayed home for 2 months or then would have come without any teeth. 25 years within our group. You can have patients as 15 years who have extracted about 5 or 6 teeth. So they come off as a result of periodontitis, and it's mostly common in adults because your age means that you have grown to see a lot, and as the oral hygiene is not optimal, then it means that your teeth become loose and eventually fall off. So we recommend that you visit us. We can do something we call deep scaling to remove all the dirt around the teeth and strengthen them up again. That is what we recommend. So that's it. Is any questions answered? Okay. So,
I've learned there are some type of food that we can also mix to bad bread. Is that all?
yes, bad breath, unfortunately, is not only the cause of dental problems. We can have nasal problems as a result of bad breath. People that can have chronic infection of the nose, so it can lead to bad breath. So when you come with bad breath, we examine and see the cause of it. It can be as a result of the food that you eat. For example, you eat garlic, you eat onion, they are good for the body, but at that instant, you yourself, you smell, you know that your mouth smells, but then they tame down after some time. So we are not saying that don't eat them, but after this, you would want to brush and floss or gargle the mouthwash to help in the smelling of the mouth. So there are some foods that by their nature they would cause your mouth to smell, but those ones are transient, they are not permanent, they will just do. So if you happen to know that it is constant, then it means that is not a cause. There are other issues, as in dental, maybe you have cavities, or you have gingivitis, or any other mouth condition that can lead to a cause. Please, any other question? Please, any other question?
Yes. When do we use the floss?
The
Floss
floss.
after brushing or something like that?
Okay, as I said, it's when you are brushing, you are still introducing food particles in between your gums, irrespective of how you want to do it. So right after, then you use the floss because you have put some food particles in between. So you are using the floss to remove and clean that part. So it is right after using the brush, and that's where the root to do all these particles. Yes, sir. Yes. After using it, you wash your mouth and then you use your mouthwash that we recommend as also part of your oral hygiene pack. Yes.
This perception that bad is always caused by this pressure. Sometimes it's not where people are especially traditional medicine, yes, and stuff. How how they respond to
Yes, yes, exactly. That, as you said, there are other causes. So it's not only your teeth. So when you have bad breath, it's better you come for proper examination. You would examine carefully all your teeth. You might even have filling, let me say cavities, that's a hole in your teeth that has accumulation of food particles that will make your mouth smell. Then you can have a plug, as I said, that will make your mouth smell. Food particles that have been left there will make your mouth smell. But besides that, when we look at all this, we normally work with patients with bad breath alongside the ENT, that's ear, nose, and throat. Because, as I said, you can have infection of the nose that can lead you to have bad breath. You can have infected problem with the brain inside that, or if the head is a unit, so it means that when everything moves, it moves down as well. So it can cause you to have bad breath, mostly problem from the nose. Then we will check if it is not as a result of that, then most likely it is your mouth. So we try to help you with oral hygiene practices, constant cleaning and all that to help prevent, remove the bad breath that you have. So you visit us and we check to see the actual cause of it, see what you have.
Sometimes people device
Yes, it's. I was going to ask, isn't it surprised why you don't bite your tongue when you eat? Because looking at how you move the tongue between your teeth, left, right, here and there, it's surprising that your tongue, sometimes your food is so delicious that you want every part of your tongue to even enjoy some. So it's normal. It's normal to have bitten your tongue during the process of eating. But then we have to, as much as possible, reduce talking. Because sometimes you can see that when you're talking is when you bite it. Because when you're talking, your tongue has to move to certain places. At the same time, you are talking and chewing. So it moves in between the gum and in between the teeth. And the teeth doesn't know that at this point in time, your gum is there. It's just going to bite it as part of your food. So we reduce talking while eating to prevent such.
this what you are describing about authors. You can ask it. Are there alternatives like a traditional ways of doing this? I'm asking because we see that very often. And I don't know how well, if they are good, how well you are making use, as a dentist, making use of alternative medicine.
Well, I am not much into how do you call it, traditional medicine, but I am not completely against it too. However, I believe that those people selling mouthwash that tend to tell you that it is the solution to every dental problem. You have dental problem, don't go to the dentist, come to me. We have herbal medicine that will help solve your problem. You have a hole in your tooth, don't go to the dentist, come to me. Whatever you put there, touch and go, whatever it is, all those medicine, they're just going to even kill the tooth. Sometimes you end up causing more harm than good. There are some leaves and sometimes the guava leaf one can use. But then when you use these ones, always remember to rinse up because they can stain the teeth as well. So there are orthodox medicine and there are traditional ones. But then you always have to get to the when you're using as preventive, it's fine. But when you have a problem and you tend to use the ones that these traditional doctors tend to prescribe, some of them they have no knowledge about dentistry, but they tend to solve them. So it's advisable you see us. And if you want to use the traditional ones, some leaves, as I said, the gamma leaf and others can help, but not relying on these.
I mean, related to the traditional manufacturer, I read the newspaper where a researcher came yesterday talking about the use of the chewing stick, recommending that some of them have some chemicals, so it helps the mouth. What is
as I said, I'm not being traditional because our grandfathers would use them and they would produce results. Yes. This chewing stick. You know, when we were growing up, there were some trees that they tell you this one you can use to brush your teeth, this one you can't, this one you can't, because maybe they haven't done any research, but they have over the days to have this knowledge on certain things that sometimes not proven scientifically, but really works. So if they came out with their research and found out the components of the chewing stick, it's not every chewing stick. Then it means that there are some components of it that help in strengthening the teeth. I am not against that if it is backed by research. So whoever said that you have the research to back their claims, and if that is, I'll check about that research and see if it holds water, and obviously yes. But I'm not against chewing stick, but you have to use them well. Chewing stick has to be used almost the same way as your toothbrush. Some use chewing stick like this. I remember my grandmother used to use chewing stick a lot, and it always used. So you're pushing the gum up. As I said, you're brushing this way, that is, you're doing a vertical brushing. But the vertical is supposed to be. There are other forms of brushing which is a little bit difficult. The vertical, but you have to move from the gum to the teeth, gum to the teeth. You see, but if you do this way, what I mean, some people do brushing this way. You're pushing the gum up. You're pushing the gum up. So it's the same way as using the chewing stick. You're pushing the gum up. So you can use the chewing stick as well. Yes. Most of, as I said, currently most of the toothpaste that are on the market are fluoride-based. First, there were issues with Food and Drugs Board that some toothpaste were in the market without fluoride. So currently, the most common ones that you see, that's it, Colgate, Pepsodent, Oral, And the others, these are the two common brands that we use in Ghana, and most of them have, except probably you have a toothpaste that you use and you want to know about the fluoride content. You can see them on the toothpaste, what it contains, but mostly all the ones that are on the market are fluoride based.
What should be the color of the teeth?
Thank you very much.
But sometimes you see some people with yellow, just like this yellow. Yes, right.
Some dentists do teeth whitening. Personally, I've never done teeth whitening. It's not wrong, but I am not in favor of it. Because as I wouldn't want somebody to bleach their skin, teeth whitening is a beautiful term for the term teeth bleaching. Yes, you're bleaching the teeth as well, but only that you use teeth whitening to say the teeth. You're saying teeth whitening because the teeth itself color is not supposed to be white, but you're using external material to whiten the teeth. So it's whitish, but it's not whitish per se, it is white yellowish. So white and yellow combined. There are people that have more, their teeth to be whiter than the others. The amount of calcium and the fluoride content in it can make the teeth a bit yellowish. But if your teeth is a bit yellow, it doesn't mean that it is off. But when it is yellow, as in a lot of capsules around it, yes, that is a problem. But the teeth is not supposed to be white. Sometimes somebody will come to me that they want their teeth to be white, and you look into their mouth, you see capsules builder. You remove the capsules, then the teeth looks yellowish, whitish, or white as they will say again. All because of the capsules that they built, but not because your teeth is yellow per se. So it's not supposed to be yellow, neither is it supposed to be white, but it's a combination of the two. But some have their teeth whiter than others. Some have their teeth yellow than others.
But if you want the white, give it to us.
Your teeth, for example, is perfect. The color is not supposed to be white. It's a combination of the two, basically. I don't think you, for example, somebody like you would come and you want it white, but the same something white. Yes.
Go to the place to buy places. The bottom of the place, some of them have the rest white color mark. Some is black, some are red, some are green, some are one type of situation, black, red, green, and black.
Yes, I think I'll have to remind myself of it. I happen to see this. Probably I'll have to do that in the next presentation. I'll bring that out. I've had this thing, but honestly speaking, I don't remember. But I will do my research and get more information. Yes, the color codings have meanings, but it's something that I have. Sorry, I can't do the color.
Sometimes I find that once a year or once in 6 months, you brush your teeth together, making powder correct.
No, because baking powder is a component of what we use for bleaching. Sodium bicarbonate. So when you are using that, it means that you yourself you are trying to bleach. But then remember that your teeth are not only components in your mouth. When we are doing teeth bleaching, we focus only on your teeth, but you are doing general teeth whitening by whitening that. And remember, there are gums, palates, there are tongues, all your teeth. So when you're doing that, you are also causing harm to the others. So if you still want teeth whitening, yes, you would have to see a professional. Then you do the teeth whitening for you, focusing on only the teeth rather than using them, taking powder to brush. Oh, I think there's, please go back in the, there's, you're seeing set of teeth brush here. The one closer to me, that's on the right mouth. The one down there is crying for help. Somebody can use one toothbrush for 1 year. You see the toothbrush, this is falling, this is here, this is there, but you are still using the toothbrush. So we recommend that 3, maximum 4 months, you should change your toothbrush, because by that time the bristles are weak. Teeth are supposed to be, toothbrushes are supposed to be used within some short time, just as you change some other things. You also have to change your toothbrush, especially when you see that they are starting to move in different directions. So after 3 months, we try as much as possible. And also try and keep your toothbrushes in appropriate places. Some keep them on the table, some keep them different locations. So remember that wherever you take it from, you're taking it back to your mouth. So where you put it means that you can also introduce things into your mouth. So after 3 months, 4 months, let's see. Even if you feel that after 2 months and it's becoming weak, you can change it, but recommendably 3 months. Let's try.
So you talked about the cleaning that we come to your outfit to do. And as you mentioned, there are plaques that are formed that you take them off. So my question is to one, how can you prevent them from forming? Because sometimes, even after the cleaning, within a month or two, they come again. And with my research, some people are prone to having a lot of them. And then the second question is that with a constant removing, it's going to have effect on the teeth. I say maybe making your teeth lighter or maybe losing them or something.
With plaque, as I said, there are microorganisms in your mouth. So as you eat as a human being, and as you are alive, there are two things that will be causing in your mouth: bacteria and food particles. So these are the components of plaque. So whether you like it or not, after 6 hours, plaque will form again. But then what do we do? Clean. So plaque will form, but you have to clean. So the essence of brushing is to remove the plaque that will be formed. So whether you like it or not, it will form. So brushing is a method of removing the plaque, which is something that would happen anyway. So it's not as a result of your oral hygiene or what, but it's converting into a approach. It is your responsibility. So plaque will form as a result of this thing. Then we talked about
The constant removal of it.
the constant brushing of the teeth. When you brush the teeth in the right way, one, as I said, brushing wrongly can lead to teeth wear. But when you brush well, it's not going to whiten the teeth. There are different layers of the teeth. There's the enamel, that is the outer part, that is a bit whitish. But there is the dentine, which is down, which is yellowish. Then they have the pulp and others that are in. But the outer part, which is the dentine, the enamel, will always maintain its color, except when there are some stains around it that will make it change color. But brushing will not make your teeth white, it only removes. The plaque itself, as I said, is even white, some whitish sort of. So as they are on the teeth, the brush just removes it. But if it keeps staying on the teeth, that's where it compares to purpose and anything. So brushing will not change the color to white, but it will maintain the color. That's a protection issue. I do it for me and where and all. Please.
Yeah. Okay. I have another question.
For sure. We have time.
No, personally, I cannot use a metal spoon to eat. It has to be a rubber spoon. Because I get some funny feeling in my teeth. As you say, it's in the film. So I don't use a metal spoon. What could be the problem?
Okay. We have patients, different kinds of patients that we attend to. You can have a patient that can be very sensitive teeth. Very sensitive. Even when you try to do cleaning, you, for example, you try as much as possible to have good oral hygiene because cleaning will not be pleasant. Because it's metal. Just eating. And imagine we have to use the scaler to clean it. It's not going to be pleasant. So, you can come to see, but if you're giving a oral hygiene, sometimes there might not be any need for the dental cleaning. So it has a result of hypersensitivity. Hypersensitive. The dentine, you have sometimes you can have exposed dentinal tubes around. So as you touch any metal, then there are some people you can do cleaning for them, just they are comfortable in it, but some you touch them with the metal, then
Could the excessive use of mouthwash cause that?
yes, some mouthwashes are, as I said, they can cause wear on the teeth surface and open the dentinal tube. So, we advise not to use alcohol-based all the time. There are mouthwashes that we recommend for some specific purposes. Some with chlorhexidine mouthwash, which has been used within some period. And mouthwash is not supposed to be like so regular like that. Even though it's part of the oral part, but it's not something that you should constantly. There are people who use mouthwash 5 times a day. Like anytime they feel their mouth is smelling, they just take mouthwash and keep it in their mouth. So you are exposing your dentinal tubes. So we advise that you don't overuse your mouthwash.
You have different types of devices for I'm asking that because recently the two guys that I bought were like the one that made 2 questions. And I was seriously about that myself. Whether maybe allow me to be young.
Please, okay.
I don't know whether each one have specific purpose.
Okay. You see, people try to come up with different brushes for a specific reason, but then that specific reason end up to cause problem. As I don't know whether you remember that brush that's called smokers. Smokers. How is the Bristol? Very hard, right? Exactly. It's because they feel that there are stains on the teeth. When you smoke, you get stains on your teeth. So they feel that hard toothbrush won't be able to scrub the stains that they have on their teeth. That's why they call it smokers. So smokers are the ones to use it. But at the end of the day, they end up removing the teeth surface. Then that's when as he said, apart from the oral mouthwash, you can also expose your dentinal tubes through hard brushing. So you can end up having teeth sensitivity because of a hard toothbrush. So please, it is not normally FDA doesn't approve such products, but you know that certainly in the Ghana market, there are some products that are in the market that are not well approved. But other thing is that sometimes these agencies, they don't involve the health professional. For example, you can have FDA, but that doesn't have a dentist in them. So sometimes they just approve it because they feel it's brush and it has bristles and they just approve. Maybe they have approved that.
So fast, how do I get to know the right brushing? But some of them do not seem to have any instructions. How do we determine?
The one that doesn't have any inspection on it is fake. It's not approved. If you are supposed to write, most of them, if you check Colgate, they write medium. Colgate medium. You see medium somewhere. It means a medium bristle brush. And there are other toothbrushes they write soft. For example, when you are in braces, they advise you use soft because there are a lot of things around them. So for the teeth to be cleaned, you need to move the brushes in between, and soft bristle is able to do that. It has toothpaste toothbrush doesn't have to be hard. A soft one is okay. So when you have that brush, probably you return it or you use it to brush your corners of the sink or some place that you need brushing, but not probably not your mouth. Please, are we exhausting the question? I believe you have other sessions where we talk about things, so then our questions work. So that's all that we can create. Okay, every Father, we thank you for successful education and education. We are very grateful that we have had such opportunity to learn, share knowledge. We pray that you help us put into practice what we have learned so that we will benefit from everything that was taught today. We pray that as we go, you will help us and give us the spirit to teach others, maintain a good oral hygiene, and bless us be able to carry out all these activities. In Jesus' mighty name we have prayed.
Amen.
So on behalf of the leadership of the Men's Ministry, say a very big thing for taking us to oral hygiene and health. I think we have learned a lot. Some of the things we didn't know. Today being the first time knowing that toothpaste can even lead to stroke. That's so interesting. And I'm sure the recommendations that you gave, we would follow it up. And also the package that you are working on as for us. We're very excited if you can liaise with your colleagues so that you can have a moderate kind of health care that we have. Very glad for you to do that. Just we thank all of you so much, especially our women for also helping us making this. No, we will reciprocate that the next time when you will have the program. But make sure it's good by that.